This is the biggest change I've seen in my practice in 20 years. It's what I am most excited about since I've come out of residency. A patient may come in and see me because she's got heavy bleeding and she was found to have fibroid uterus. As it turns out, she's been dealing with this for about 3 years because her mother had the same thing, and she had surgery using a traditional laparotomy, big incision. She was in the hospital for a week and didn't feel well again for 8 weeks. What I can now tell this patient is, let me bring you into the hospital. I can use small incisions. You can go home the same day. I'll have you driving in 3 days, and you can be back to work in 2 weeks.
You know, we've been doing this for 3 years, and we still say it's a great operation. It's a really sweet operation because it really allows the patient a comfort level that they wouldn't have otherwise if they had to have a major operation or a major incision.
The procedures would be as follows. Office tubal sterilization, office endometrial ablations for heavy bleeding, then transitioning to the hospital. We do laparoscopic supracervical hysterectomies, total laparoscopic hysterectomies. We can combine those procedures with removal of the tubes and ovaries as well. We can do laparoscopy for pelvic pain and endometriosis, laparoscopy for removal of ovaries and tubes if we need to, for a history of breast cancer or for a history of ovarian cysts. An example of a recent patient is a patient of mine who had a fibroid uterus, and the fibroid itself was the size of a grapefruit, and that's 10 centimeters. She had not only heavy bleeding from this, but pelvic pain. And we were able to see her, get her into the hospital. We did the hysterectomy. The specimen itself weighed 1.5 pounds. She was able to go home the following day, and she's back at work as we speak, which is 2.5 weeks after the procedure. This is someone who's been living with pain for 3-4 years. She'll look me in the eye and say, "This was so easy. How could I possibly have waited for so long?"